Question number 146. A 36-year-old male suffers from fatigue, weakening and paralysis of skeletal muscles. The doctors conclude that he is suffering from an autoimmune disorder affecting the neuromuscular junction. The disease he is diagnosed with is. The options given are rheumatoid arthritis, osteoporosis, muscular dystrophy, myasthenia gravis. The correct answer to this question is option number 4, myasthenia gravis. This disease is an autoimmune disorder which affects the neuromuscular junction, and the patient suffer from fatigue, weakening and paralysis of skeletal muscles. Let's discuss the rest of the options. The next option is rheumatoid arthritis, and it is an incorrect option because rheumatoid arthritis is also an autoimmune disorder, but it is diagnosed by the presence of rheumatoid factor, and the symptom involves inflammation of synovial membrane. The next option is osteoporosis, and this is an incorrect option. Osteoporosis is characterized by decreased bone mass and increased chances of fracture. And the next option is muscular dystrophy, and this is an incorrect option because muscular dystrophy is a genetic disorder leading to progressive degeneration of skeletal muscles. So the correct answer to this question is option number 4. Let's move on to the next question. Question number 147. Choose an option representing symptom which is not found in an infant suffering from marasmus. Not found. And the options given are thin limbs, prominent ribs, edema and wrinkled and dry skin. Marasmus is a disease in children below 1 year of age due to protein and energy malnutrition. Thin limbs, prominent ribs and wrinkled and dry skin are characteristic features of marasmus, so these cannot be the correct answer. But edema is seen in kwashiorkor, so the correct answer to this question is option number 3, as it is seen in children suffering from kwashiorkor. So the correct answer to this question is option number 3. Let's move on to the next question. Question number 148. All of the following centers are found in forebrain except, and the options given are hunger, thirst, pneumotaxic, and the last option is thermoregulatory. Pneumotaxic center situated in pons is considered as a part of hindbrain and not of forebrain, whereas hunger, thirst and thermoregulatory center is situated in hypothalamus, which is a part of forebrain, so these cannot be the correct answer. And the correct answer to this question is option number 3, as pneumotaxic center, which is situated in pons, is a part of hindbrain. Now let's discuss our next question, which is question number 149. Which of the following statements is correct without any exception in humans? And the very first statement given is arteries carry oxygenated blood, whereas veins carry deoxygenated blood. And this is an incorrect statement because there is an exception to it. Because all arteries carry oxygenated blood except pulmonary and umbilical arteries, which carry deoxygenated blood. The next statement is arteries always carry blood away from heart and veins carry blood towards the heart, and this is a correct statement without any exception in humans, so this is a correct answer to our question. The next statement is all veins possess valves, and this is an incorrect statement because pulmonary vein do not possess valves. Pulmonary vein does not possess valves. The last statement given is blood capillaries are always present between an arteriole and a venule. And this is an incorrect statement because blood capillaries may be present in between two arterioles as well as in between two venules. So the correct answer to this question is option number 2. Let's move on to the next question, which is question number 150. The interrelated processes of urine formation are, and the very first option given is filtration, urination and absorption, and this is an incorrect option because the interrelated processes of urine formation are ultrafiltration, selective reabsorption and not absorption, and tubular secretion. Whereas in the option, processes are filtration, urination and absorption, and as urination and absorption are not the processes of urine formation, so this is an incorrect option. The next option is tubular secretion, yes, reabsorption, yes, and micturition, and this is an incorrect option because micturition is not an interrelated process of urine formation. The next option is excretion, storage and micturition. This is also an incorrect option as excretion, storage and micturition are not the interrelated processes of urine formation. And the last option is ultrafiltration, selective reabsorption and secretion, and this is a correct answer to our question. So the correct answer is option number 4. Let's move on to the next question.